This year, our seminars will feature presentations by researchers and partners focused on understanding and addressing health inequities in Cleveland and beyond. So before we get started today, just a few logistics and housekeeping for today's seminar. Please use the Q&A feature to type in your questions. Also, there's a raise your hand feature, which you can use during the Q&A period after the presentation if you would like to request your microphone to be unmuted. As we navigate this new way of delivering seminars, please bear with us if any technical issues arise. So now I'm excited to introduce our speaker for today. To kick off this year's seminar series is Dr. Erika Trapl with her presentation on the equitable impact of Cleveland's Tobacco 21 policy on youth use of tobacco products. Dr. Erika Trapl is a behavioral epidemiologist who has developed her community partner tobacco control research program for over a decade. She's the director of the Prevention Research Center for Healthy Neighborhoods, associate director of community outreach and engagement at the Case Comprehensive Cancer Center, and as associate professor in the Department of Population and Quantitative Health Sciences at Case Western Reserve University. Dr. Trapl's work contributes to local, state, and federal impact. Dr. Trapl is the PI of a NIDA-funded R01, which examines the impact of flavor on young adult use of cigarillos with the goal of informing federal tobacco regulatory policy. She has served as the chair of the Healthy Cleveland BreatheFree Committee since 2016. Dr. Trapl, go ahead and take it away. Thank you.
Thank you, Sarah, and thank you for that lovely introduction. I am very excited to be starting off our September seminar series. We have a wonderful year planned, and I am excited to see that we have such strong attendance even with the shift to our virtual presentation mode. So thank you all for being here. And also thank you for the opportunity to share this very exciting presentation today. It's been a real joy to be able to work on this in this space for the past several years and to be able to share successes. So I'm looking forward to sharing this with you today. So tobacco use is not a new topic. And in fact, we oftentimes point to the fact that we have had a decline in cigarette use going back to the 1960s with our first real pushes on the Surgeon General's report. And we look at this decline over time as a notable public health achievement. And yet what we know is that there are still significant disparities that exist within tobacco use across different populations. What we also know is that despite this decline in cigarette use over time, we still see that cigarette smoking is responsible for nearly 500,000 deaths per year. And this includes not just the deaths of smokers, but those who have been exposed to secondhand smoke. And if that's not enough to convince some folks, then I know others are oftentimes convinced by the large economic cost of smoking in our economy. So it's over $300 billion per year, with that being split nearly half on direct medical care, as well as lost productivity. So this is a substantial impact that tobacco has in our country. We used to offer this statistic that each day, 3,200 youth would smoke their first cigarette, and 2,100 of those youth would become daily smokers. We've had to modify that statistic because of the expansion and explosion of other tobacco products that are used by young smokers. And so now the CDC has adapted that initial statistic to reflect that each day, almost 1,600 youth under the age of 18 smoke their first cigarette, and 200 of those will become daily cigarette smokers. Again, this seems like a win, but it's mainly reflective of the fact that we don't have very good data on how youth who use other tobacco products, such as what I featured here, go on to become regular smokers. And so these products continue to be of concern in contributing to ongoing nicotine dependence among youth. So there's been a lot of discussion around what policy approaches could be used to address youth access. And one of the policy approaches that has obviously gained substantial momentum and being adopted locally in the state and federally, is increasing the minimum legal age to purchase tobacco products, because what this does is it effectively reduces access to near age peers who are willing to buy tobacco for underage youth. We know from our own local data and other data from across the country that youth who smoke in high school generally access their tobacco either through purchase, but also frequently through having other people purchase for them. So by increasing the minimum legal age, we reduce the number of students in school who are maybe 18 and 19 years old who were previously of a legal age to purchase for their younger peers. And we shift that age up so we reduce access to those products. And this is also important because we know that 94% of adult smokers began using tobacco before the age of 21. 18 to 21 is, again, a critical period where many young adults are transitioning from experimentation to regular use. And so any opportunity we have to push that age of transition to regular use to a later time means that we're likely reducing adolescent initiation overall and ultimately reducing adult smoking. So as Sarah introduced me, she mentioned that I've been chairing the BreatheFree Committee, and I want to share that it's in the context of the Healthy Cleveland Initiative. And the Healthy Cleveland Initiative was enacted through legislation by Mayor Frank Jackson in 2011. And it was a bringing together of the health systems in the city of Cleveland as well as the city of Cleveland government, and recognizing that there were expansive disparities experienced by residents in the city of Cleveland, and that collectively we should begin looking at policy opportunities to address those disparities and ensure that we were really addressing opportunities for equity. There was a renewed commitment with Healthy Cleveland 2.0 in 2013, and from that emerged a group we call BreatheFree, which focused on tobacco and clean air. I joined the group at just around that time when it emerged, and was excited to begin talking about opportunities to address and reduce tobacco use. The members of that committee at its initiation and still currently included partners from our health systems, nonprofit organizations such as the American Lung Association, American Heart Association, and American Cancer Society, as well as the Cleveland Metropolitan Housing Authority and school district partners. And at that time, one of the things that we all felt that we could easily agree on, and that others in the community would agree on, is that we would want to prioritize policies to reduce youth access to tobacco. It's pretty hard to find anyone who will argue with reducing access to youth. And so at the Prevention Research Center for Healthy Neighborhoods, we've regularly collected data within the city of Cleveland that would help inform both behavior, so you'll see our youth smoking brief off to the right, as well as access, and you'll see our youth tobacco use and sales outlets in Cleveland map, which we've been collecting for a number of years. And so we used this data to help inform the committee and help us consider whether or not a policy that might increase the minimum legal age to 21 would be a policy that might be effective in reducing tobacco use within the city of Cleveland. And so we went through a series of meetings with Cleveland City Council's Health and Health Committee, and presented a lot of information, answered a lot of questions to Cleveland City Council. And in December of 2015, City Council adopted ordinance number 737-15, which prohibited the sale of tobacco to persons under the age of 21. And you can see that the definition of tobacco product was expansive and included cigarettes and other tobacco products, alternative nicotine products such as electronic cigarettes or vapes, as well as papers used to roll cigarettes. And as part of that legislation, all retailers were required to post signage such as what I'm showing here, which was provided by the Cleveland Department of Public Health, informing customers of the minimum sales age in a highly visible location. At the time of this policy adoption, the Cleveland Department of Public Health was was experiencing some leadership transition. And so Cleveland City Council was comfortable leaving the enforcement language as to be developed. And so there was a placeholder whereby the health department was to begin to develop that language and introduce enforcement to ensure that the policy would be maintained. So I want to put Cleveland's adoption of Tobacco 21 into the larger landscape. of what was happening. And so I've indicated a few important time points here. On the left, you'll see in 2013, I mentioned that we initiated the BreatheFree Committee and began discussing policy options to reduce youth access to tobacco. In December of 2015, Cleveland City Council adopted Tobacco 21 policy, and it was implemented in April of 2016. It was a good 3 to 4, almost 4 years, just over 3, before the state of Ohio decided to enact its own Tobacco 21 policy in October of 2019. And then just a few months later, we had a federal Tobacco 21 policy go into effect in December of 2019. So this actually created an opportunity for us to see how the policy in Cleveland may have impacted Cleveland youth prior to the adoption of state and federal policy. So as we looked at this opportunity within the Prevention Research Center for Healthy Neighborhoods, we asked ourselves a set of questions. First, we were curious to know if retailers were compliant with the Tobacco 21 policy within the city of Cleveland, both with signage and with sales. Second, we were interested to see if smoking behavior for high school youth in the city of Cleveland differed significantly from the surrounding region 1 year after the implementation of Tobacco 21 policy. And then lastly, within the city of Cleveland, we were curious to see if the policy equitably impacted tobacco use behaviors among youth by race and gender across all tobacco products. And so we set out to use our existing surveillance systems and enhance those with a compliance check and a random sample of retailers so that we could attempt to get a handle on how the Tobacco 21 policy was actually impacting adolescent smoking behavior within the city of Cleveland. Within the Prevention Research Center, we have managed the Cleveland Food and Tobacco Retail Database since the year 2012, when we began conducting a comprehensive audit of every food and tobacco retailer within the city of Cleveland, documenting in a very brief fashion foods that were sold and tobacco products that were available. We also have been conducting the Cuyahoga County Youth Risk Behavior Survey, which has assessed tobacco use behaviors for a number of years. And as I mentioned, we enhanced these two surveillance systems with a sales and signage compliance in a subset of retailers. And I'll give you a little bit more information about each of these methods. But what I want to show you here is how our data collection overlays naturally with the rollout of these policies. Our WireBS data is collected among high school youth in the odd year. So you'll see an X indicating when we collected that data in Cuyahoga County in 2013, 15, 17, and in the late fall of 2019. We also conducted the retail surveillance where we checked for signage in the summer of 2017. And our compliance check addition was completed in the early spring of 2018. As I mentioned, to assess signage compliance, we drew from the Cleveland Food and Tobacco Retail Database. Again, this is a surveillance system that's documented Cleveland's food and tobacco retailers since 2012. Every summer, until this past summer, we would recruit a small army of research assistants and train them as our interns. They would drive the streets of Cleveland visiting all retailers and completing a brief 2-page assessment of food items, as well as availability, placement, and advertising of select tobacco products. And in the summer of 2017, we added an item asking our small army to assess whether or not Tobacco 21 signage was posted at the store with just a yes/no response. To get a better handle on sales compliance, we took a subsample of retailers from the Cleveland Food and Tobacco Retail Database, an NF57. And we recruited 4 young adult volunteers under the age of 21 who we trained to purchase tobacco products. We recruited 2 males and 2 females. And for each store, we randomly assigned purchase of either Marlboro Red cigarettes or White Owl White Grape cigarillos. Our volunteers collected this data in January and February of 2018. And I am very proud to mention that this effort was led by one of our MPH students at Case Western Reserve University, Neha Gupta, who is currently a 3rd-year medical student. She was completing this project as part of her MPH capstone. We also, as I mentioned, have monitored youth tobacco use using the Cuyahoga County Youth Risk Behavior Survey for a number of years. Broadly, the Youth Risk Behavior Survey captures health behaviors that contribute to high school risk and chronic disease development and morbidity. And tobacco is included in those items. And we've collected this consistently since 2013 for our high schools. And I've provided a brief map here so that you can see, if any of you are familiar with our work here, you know that we have regularly collected data to represent the 6 regions of Cuyahoga County, representing the city of Cleveland, the inner ring or first ring suburbs, and the outer ring suburbs, east and west as divided by the Cuyahoga River. And so for this research that we conducted, we were able to extract the Cleveland only data and compare this with data collected in the inner and outer ring suburbs. For those of you who may be a little bit less familiar with Cleveland and Cuyahoga County, I wanted to provide a little bit of demographic background so that you could see what we might be comparing. We were comparing Cleveland to Cuyahoga County because although the populations are different, the remaining geopolitical climate is fairly similar, the media marketing is similar. But we do have these demographic differences between the city and the rest of the county that have contributed to and been associated with the differences that we've seen in tobacco product use in youth in the city of Cleveland as compared to youth in Cuyahoga County. But we felt like this was a reasonable comparison given the data that we had collected over time, and again, the regional similarity and experiences of Cleveland being within Cuyahoga County. Within the Youth Risk Behavior Survey, these are the items that we have measured and have included in our analysis. So current cigarette smoking is considered having smoked a cigarette on at least 1 day within the past 30. Current cigar use, we assess using an item that asks if a student has smoked a cigar, cigarillo, or little cigar, such as a black and mild or Swisher Sweet, on at least 1 day in the past 30. We combine these 2 items to look at current combustible tobacco use. So this is current use of cigarettes or cigars. And then since 2015, we've assessed e-cigarette use or vaping. And again, this is having used an e-cigarette or vape product on at least 1 day within the past 30. So these were the outcome measures that we were looking at over time. We used different analytic approaches to assess each of our different types of data. We used some spatial density mapping, which I'm going to show you shortly, to help us understand where stores were non-compliant with signage. We used some basic chi-square and t-tests to look at differences within store characteristics for stores that were sales compliant versus non-sales compliant. And then we did a differences in differences approach to assess trends in youth tobacco use. I'm very excited to show you our results, and I want to give you a little sneak peek of what to anticipate. So I'm first going to talk about our results with regards to retail signage compliance in the city of Cleveland. Then I'll give you a brief overview of our retailer compliance with sales. And then I'm going to walk you through a series of really exciting graphs around our YRBS tobacco use. So the best way to share with you all our signage compliance data was to plot these retailers in this map and to show you where we had the most density of retailers who did not display signage in 2017. And so overall, what we observed in the summer of 2017, which would have been 1 year post implementation of Tobacco 21, is that only about half of the retailers in the entire city were still displaying the required signage. And what we saw is that those that did not have signage displayed tended to cluster predominantly on the east side. For those of you who are from the area and perhaps are more familiar with neighborhood names, this is how our neighborhood map maps onto our observations of sales non-compliant. So while that was a bit concerning, we went back in and did our sample of 57 stores where we conducted our sales compliance checks. And what we found is that in those stores, again, just over half of those retailers were sales compliant. which means that they carded and did not sell tobacco to our underage volunteers. However, what we saw when we look at compliant retailers versus non-compliant retailers is that there was no significant difference in their presentation of signage, in the gender of the purchaser, nor in the product that our purchaser attempted to buy. So it didn't look like the non-compliance were different than the compliant stores as far as who was purchasing, if there was signage displayed, and the products that were being sold. So this was positive news. All right. So now I'm going to move into the behavior. And again, I just want to orient you to how we're comparing our YRBS data. So we've combined data for Cleveland, which is the yellow and light green in the center of this map. And then we're contrasting that and comparing that with non-Cleveland Cuyahoga County data. So this constitutes the red, orange, olive, and what I'm calling maybe a dark green or teal region of our county map as comparison. Okay, I'm going to, excuse me as I adjust my screen. All right, so I'm going to walk you through, because we're going to have a series of these line graphs, which I think present the change over time in a little bit of an easier way than if I were to show you some numbers. So this graph shows us the prevalence of current combustible tobacco use in Cleveland and non-Cleveland Cuyahoga County from the year 2013 through 2019. The Cleveland data is in green. The rest of the county is in yellow. The black line represents the point in time in which the Tobacco 21 policy went into effect. And you'll see that towards the end, we have identified when the state policy and federal policy went into effect. And I'll explain that in just a moment. So I'm gonna spend a little bit more time on this one so that we're all comfortable with what we're seeing in these graphs. What you can see from 2013 to 2015 is that the current use of combustible tobacco, so again, that's cigars or cigarettes in the city of Cleveland, was on the increase. It rose from around 22% overall to about 26% overall, while the prevalence of current use of combustible tobacco in the remainder of the county stayed about the same. However, post-implementation of Tobacco 21, we see a steep decline. So not only is it a complete shift in the direction, but a decline in the use of combustible tobacco products in Cleveland, which looks to be a bit more dramatic than the decline that was observed in the rest of Cuyahoga County. And in fact, this is statistically significantly different. We've included the 2019 data point as just a point of interest because we thought you all might, want to know what happened after that first year. And what we see is that Cleveland continued to decline. We also see a continued decline in the rest of the county. And that may be due to the fact that we collected this data at the exact same time in 2019 that the state was implementing its Tobacco 21 policy. And so it's possible that the continued decline in 17 to 19 could be attributed to state policy. But our statistical test that we're looking at here is for the change from 13 to 17, and we see a statistically significant difference in the change between Cleveland and the rest of Cuyahoga County. We wanted to look at specific tobacco products to see how those may have changed. What's interesting here is that in the non-Cleveland part of Cuyahoga County, we've observed regularly a higher prevalence of cigarette use in the rest of the county. However, we see that same trend in Cleveland, that cigarette use was increasing from 13 to 15, and then we see a significant decline from 15 to 17. Another trend we've seen consistently is that the city of Cleveland has a higher prevalence of cigar and cigarillo use as compared with the rest of Cuyahoga County. And again, we see that Cleveland was increasing at the time of 13 to 15, and then had a significant decrease from 15 to 17. And then we see a similarity in the decline from 17 to 19, which may be influenced by the Ohio policy. And then we looked at vaping or e-cigarette use. Again, we did not have 2013, so we don't have a way to know what that looked like prior. But what we can observe is that the Cleveland trend and Cuyahoga County are trending down from 2015 to 2019. And that the use of these products is actually lower in the city of Cleveland than in the rest of Cuyahoga County. So our next set of questions really wanted to focus within the city of Cleveland and to assess whether or not the effect of this policy was equitably impacting tobacco use behavior among youth by race and gender and across all tobacco products. So again, I'll spend a little bit more time orienting you to this particular bar graph to help you understand what we're seeing here. We looked at race, ethnicity, and gender combined. So you'll see representation for white males and white females in blue, black males and black females in light green, and Hispanic males and Hispanic females in yellow. I'll walk you through charts for each tobacco product, and the first one we're starting with is cigarette use. And what you'll see is that there are slightly different patterns over time by race, ethnic, and gender group. So for example, in blue, we see that white males from 13 to 15 had a steep increase, and then at the point of the policy, we see a steep decline. We see a leveling for white females, leveling for black males, and what could be considered a slight incline for some of these groups here. But what we see across the board is that all groups declined in use of cigarettes from 2015 to 2017. And for most groups, we see a continued decline from 2017 to 2019. What's also incredibly interesting is that we see that the gap between the lowest use group and the highest use group becomes much tighter. So instead of a range from just under 5% to 16%, we've tightened that up to about 2% to 7% of a range across these groups. This is a similar chart showing cigar product use, again, by race, ethnic, and gender groups. And in some groups, again, we see that some groups were on the increase from 13 to 15, and we see consistent declines in use of cigar products from 15 to 17 across all racial, ethnic, gender groups, with continued declines from 17 to 19. And again, you'll see that notable shrinking of the gap between the lowest use group of white males and the highest use group of black females in 2013, from about a range of 7 to 22 down to a range of about 7 to 12 in 2019. Finally, we looked at e-cigarette use, vaping, and again, starting with 2015 for consistency of our data, we saw consistent declines across all racial and ethnic groups. And again, that tightening of the range from our lowest use group and our highest use group from 2015 to 2019. This tightening is not quite as pronounced as in the other product uses, but it's absolutely still a much tighter span across racial, ethnic, and gender groups than we had in 2015. So in summary, what I'd like to share with you is that despite moderate signage and sales compliance, use of cigarette and cigar products and vapes among Cleveland high school youth declined after the implementation of Tobacco 21 policy. We know that those declines were significantly different from the rest of what was happening in Cuyahoga County from 2015 to 2017. We know that declines were seen across all tobacco products, and we know that declines were seen across racial, ethnic, and gender subgroups during those same time periods. To me, this is great news. It's very exciting and great news. And this is the part I really don't like about doing a virtual seminar, is that I can't see all of the good news faces that I'm hoping that you all have right now. So I want to step back and go back to our early signage results and pose the question, does it matter? I mentioned that at the point at which we observed signage, which was about 1 year post implementation of the policy, we only saw about 50% of stores that had signs displayed. And in fact, I will share with you that the proportion of stores that continues to display signage decreases. And as of 2019, less than a third of the stores were compliant with the signage component of the Tobacco 21 policy in Cleveland, and only less than a third of stores were still displaying that signage. Does it matter? I would say my short answer is probably, because signage really we can think of as serving two key purposes. First, it serves as an ongoing reminder to purchasers and retailers that the minimum legal age to purchase tobacco products is 21. The second thing is that it establishes and reinforces the new social norms within our broader community that sales will not be made to individuals under 21 years of age. And so even if you are not intending to purchase, the signage serves as a reminder of the new social norm that the legal age is 21, and that this just isn't something that folks in our community do. We don't sell tobacco to individuals under the age of 21. And so it's important in ensuring that we're continuing to send a strong social norm message and remind retailers and potential purchasers that the minimum legal age to purchase is 21 years. I want to also highlight and remind you all that the results that I've presented today represent a Cleveland policy which still has no firm enforcement plan. As I mentioned, at the time that the policy was adopted, there was some flux in leadership at the Cleveland Department of Public Health, and there was an expectation that enforcement would come. And in fact, newer Tobacco 21 policies that were adopted after Cleveland adopted their policy have included provisions to establish tobacco retail licensure, which then allows municipalities to require tobacco retailers to apply for a license, but it also creates a natural opportunity to enforce any consequences for violations of the Tobacco 21 policy. So enforcement is a discussion that is currently ongoing, and I'll say more about that in just a moment. There's also an opportunity to integrate signage check as part of retailer inspections. And if we think that signage continues to be important, we can build that in and think about how we make those signs available, perhaps as part of our retailer inspections. I've mentioned also that in the course of our studying this work, that both the state of Ohio and federal policies have been modified to increase the state and federal minimum legal age to purchase tobacco products to 21. However, this does not diminish and should not be seen as something that diminishes the importance of the city's policy. Local policies here in Ohio are not preempted by state laws for Tobacco 21. And so we have the ability within the city of Cleveland to continue to enforce our own policy that is written. And it is more likely that within the city we have more resources available to do that than we may expect the state or the federal government to utilize in enforcing our policies here. I wanted to provide just a little bit of understanding of what the state and federal legislation include. The state revised code is similar to what we have in the city of Cleveland, in that tobacco retailers cannot sell to individuals younger than the age of 21, and that there must be a conspicuously placed printed sign with letters that are at least a ½ inch high that state that tobacco sales to a person under 21 years of age is prohibited by law. The Ohio Department of Health makes these signs available for download, and did distribute those signs to all retailers when the policy was enacted in late fall of 2019. So it is possible that I mentioned less than a third of the retailers in the city of Cleveland had signs in the summer of 2019. It is entirely possible that that number has gone back up following the state's adoption of Tobacco 21 policy. The federal policy does not require signage to be displayed, but it does require that tobacco retailers cannot sell to individuals younger than the age of 21. And one thing that I failed to mention in discussing Cleveland's policy that I think is very important is that these policies focus on the retailer as the point of enforcement and the point of policy, and not on possession or use among individuals. And so if a young person under the age of 21 is found to be in possession of tobacco, there is no enforcement penalty on that individual. The enforcement of the policy is at the point of the seller and the retail owner who are liable for the sales action. So I want to acknowledge just a few of our limitations that could influence the interpretation of some of our results. Our compliance checks were completed by university students, not community residents and community resident volunteers. So they may have been perceived as outsiders and could have cued someone in as being a little bit off of who might normally come into the store. So that could have had an influence on sales compliance in any direction. Second, we are using surveillance data. So that's cross-sectional data over time as opposed to longitudinal data. So we're not actually monitoring the effect that this has had on specific children, but on the population at points in time over time. Third, I want to acknowledge a little bit of potential contamination in actually two different ways. There was one other municipality within Cuyahoga County outside of Cleveland that adopted Tobacco 21 policy in December of 2016. And so it's possible that there was some impact of that municipality observed within the non-Cleveland Cuyahoga County data. And it is absolutely true that all of the communities that border right up against the city of Cleveland, aside from the one that adopted Tobacco 21 in December of 2016, continued selling tobacco products to individuals who were 18 and older. And in fact, during some of our compliance checks, the retail operators were, I'm sure, attempting to be quite helpful and shared that while they could not sell to individuals under the age of 21, that there were stores just down the street and across the city line that would be happy to sell to someone who was 18, 19, or 20. And then the last point that I will share is that our impact is really limited to only a one-year impact because of the introduction of state policy, which may muddy the interpretation of the impact of Cleveland's policy on Cleveland youth. When thinking about next steps, I want to provide both local impact next steps as well as future research next steps, because to me, there's a lot to learn from Cleveland that influences how Tobacco 21 may be implemented in other municipalities that are similar. So I mentioned earlier that our Cleveland policy still is waiting for an enforcement plan, and that more recent iterations of Tobacco 21 policy have included tobacco retail licensure. In collaboration with our BreatheFree Committee and a number of our committee members and organizational partners, there's been a proposed revision to the Cleveland legislation that is currently under review with the law department that would ensure and provide a way for the city of Cleveland to effectively enforce its policy. In addition to that, the city is considering additional policy that may further impact youth tobacco use rates. The use of cigarettes has been driven very, very far down, such that we are at a point where perhaps I think it's around 2 to 3% of high school students are considered current users of cigarettes. It's extremely low. The products that continue to be used by youth in our community represent products that are still marketed and sold with a range of flavors that are very attractive to youth. So this is being considered by the Cleveland Department of Public Health and is being advocated by other members of the BreatheFree Committee. We would like to continue to look at the longer term impact of these policies on youth tobacco use. We've done the analytic tests on 1 year out. I've shown you 3 years out at 2019, and we're still feeling optimistic. But you know, there remains a part of me that says, okay, that's 2 data points, but let's get one more and make sure that we really have driven that rate down and we're sustaining that downward trajectory on youth tobacco use within the city of Cleveland. And then the third thing that I think is a really interesting opportunity for us to explore is what's the potential impact of this policy on adult smoking prevalence? For those of you who have been to our seminars before or have heard any of our talks about smoking in the city of Cleveland among adults, you'll know that we've shared that our own local BRFSS data, adult surveillance data, has indicated that 38% of Cleveland adults smoke any tobacco, and that was measured as of 2015. And so that there's a lot of opportunity and a lot of work to be done to drive that rate down. One way we can think about driving that rate down is by promoting cessation. But the other way that we can drive that rate down is by reducing the number of new young smokers who then become, really cut off the pool of new smokers who continue to maintain that high rate. But there's also the question of, to what extent does this policy, if at all, encourage, promote, or support adults who are considering quitting smoking? And that's something that we haven't yet had the opportunity to investigate. And as I wrap up, I would just like to acknowledge all of the partners who have been a part of this work and a part of the presentation and the data that I've been able to share with you today. I particularly want to thank the Cleveland Department of Public Health and the members of our BreatheFree Committee who have worked so diligently to prevent tobacco use among Cleveland youth for a number of years and continue to keep this a high priority. I'd like to thank the local schools and local retailers who have welcomed the data collection teams from the Prevention Research Center for Healthy Neighborhoods every year as we ask them to share their information with us. I'd like to thank the faculty, staff, and interns at our center who contribute to this local surveillance data collection every year. And I'd like to thank our past and current funders who have supported our different surveillance systems, who have really allowed us to make this a natural experiment in real time to examine the impact of this policy in our local community. And so with that, I will say thank you for your time. And I would be happy to entertain discussion and questions about anything that I've presented today. Thank you.
We have a couple in our Q&A. So our first question is there a way to mandate signage for tobacco retailers?
Yes, so the language in the Cleveland ordinance does actually require that signage is posted. And so the challenge again comes with enforcement and also reinforcing the expectation of that policy. And so as we move forward with compliance checks, I think that signage may be part of that, and we can think about how the city may leverage its resources to integrate a check for signage into some of its ongoing inspections. We could consider if there is value in distributing new signage. But again, we also can keep the responsibility on the retailers to be compliant. And there are signs that are available for download through the Ohio Department of Health in other locations that stores can maintain themselves.
Another question we have is, I know that many youth empty the contents of the cigarillo in order to use the shell. The shell could also contain nicotine and even carcinogens. I'm curious if this is a factor that you thought about measuring. As a follow follow-up question, I noticed more smoke shops cropping up in suburban neighborhoods that offer more eco options, like hemp cigarillos or wraps. I wonder if those who use these products count them as a cigar or cigarillo. Do you think this has an impact on the rates shown in the urban versus suburban areas? And thank you for your work.
Mhm. These are all great questions. I probably won't have a perfect response, but I'll do my very best. Our YRBS data has always concurrently examined marijuana use or cannabis use. And I believe we have, for the last handful of years at least, consistently asked our youth what's the most common way they use their marijuana or cannabis. And not surprisingly, the overwhelming majority of youth in our entire county use flavored cigarillos to smoke their marijuana or cannabis. And so what we see is oftentimes those who are just using it for those products don't actually identify as a current cigarillo smoker. So that we know we're slightly underestimating those who are using those products for cannabis, but perhaps not with all of the tobacco in it. So there's a slight underestimate. There is, I think, built in there, perhaps, not sure if this was the intention, but there is perhaps a research question is what is the unintentional impact of this policy on how youth are using their cannabis, and if it's changed forms because cigars may be less available. We've not looked at that, but that is something that we could look at. I'm a bit less familiar with some of the eco options that the participant framing the question just asked about, but it's not surprising, I think, in this market and with all of the policies that are coming down in local municipalities at the state level and within the USDA's US FDA's Center for Tobacco Products around tobacco regulation. Tobacco marketers are looking for a way to make these products more appealing. And so there are angles perhaps that appeal to different groups. So it does not surprise me, and there are many colleagues who we regularly go back and forth when we see new products or new marketing tactics that attempt to appeal to new groups. That's something that we can absolutely keep an eye on. Thank you for that.
I have a comment that said, great work, thanks. And another question, great presentation. Do you by chance know if the state of Ohio has a tobacco retail license on the books and whether it includes all tobacco products, e-cigarettes? If yes, any further insight on who and how they do compliance checks, whether every retailer gets one annually, what the gaps are between the state compliance checks, and what needs to be filled with a local TRL?
Yes. These are great questions. And admittedly, I've just pulled up the Q&A so that I can, and Sarah, I'll ask you not to move it yet so that I can try to answer all of the pieces there. So I believe that licensure works currently through the counties because that is how tobacco taxes are collected. And that is typically how retail licensure has been used, is to collect excise tax from retailers, and so they can connect it to that. The retail licensures for the state of Ohio are inclusive of all tobacco products. I actually just checked the most current legislation in preparation for this, and so this includes any and all tobacco products, and so this includes traditional products such as cigarettes, cigars, hookah, but it also includes e-cigarettes, vape pens, and the e-liquids that are sold in all of these cases. So all of those products are considered tobacco products as defined by the state policy and the federal policy, and also in the city of Cleveland. So all of those, the age is 21. With regard to compliance checks, these are done differently, and this is why I highlight the importance of local policy and local enforcement. The FDA is responsible for federal compliance checks. They take underage volunteers and randomly choose stores. They work in collaboration with local jurisdictions, but this happens very rarely. And in fact, as of this year, 2020, when I checked the listing of compliance checks in the state of Ohio, only one retailer in the city of Cleveland had been assessed for compliance with current federal policies. The state, through the tobacco program, from what I'm aware of, is encouraging tobacco grantees, local tobacco grantees, to engage in their own compliance checks and to conduct those in a standardized fashion. And again, depending on who's conducting those, it's unclear if those folks have enforcement power and what that looks like, and if there's any follow-up. Compliance checks have been used as an advocacy opportunity where youth will go and actually conduct those compliance checks, and then we'll send letters to the retailer if they are not compliant, or also share that with their community policymakers to raise awareness on this issue. And so that is where the gaps can be filled by attention to local policy, because there can be a local enforcement plan and local compliance checks, and then enforcement, again, that relates to the penalties that are set by the local jurisdiction.
We have a comment. This was a very informative presentation. Thank you, Dr. Trapl.
Thank you.
A question of, is there a way to examine whether retailers in neighborhoods with higher racial ethnic minority populations might be more likely to violate T21 policies?
Yes. And since I'm looking at that, I'll say thank you, Julia. I'm happy to answer that question. And to do that, I'm going to go back, and I hope you'll forgive me for going back to our signage map. Right here. So for those of you who are perhaps a little bit less familiar, even those of you who are familiar with Cleveland, we have a very segregated city, and although we're a majority city, the overwhelming proportion of African American and Black families in our city live on the east side, where we actually see those red spots with low signage compliance. When we looked at our sales compliance data from the sample of 57 stores, we saw no difference with sales compliance with the demographics of the census tract within which they were located, or even something as crude as east side versus west side. So with that small sample from of an N of 57 in 2017, we don't have sufficient evidence to suggest that there is a higher non-compliance with sales in neighborhoods that have higher proportions of Black or African American youth or Hispanic Latinx youth at this time. The sales, the sign compliance is disconcerting, and that's why I gave my caveat at the end that signage probably still is important, especially for setting those social norms and encouraging that downward trajectory to continue and not start to shift. But this is part of what we hope to continue to monitor. Thanks for that question.
Another question is similar to Julia's question. I'm curious how both compliance, sales and signage, and youth use over time varied by neighborhood level income and or educational attainment, given that there are existing disparities in tobacco use by socioeconomic status.
Mm-hmm. Sure. So so building off of, I don't know if a bit of my previous answer helps, but again, this data that I'm showing in this map is just signage compliance. And it is a bit worrisome to see where we have a lack of signage compliance, at least in 2017. This is partly why, again, I mentioned that I think we should continue to monitor signage. We have a little bit more of a challenge of looking at youth use and mapping it in quite this way. We collect our data from 20 high schools within the city of Cleveland, about 20 ish. Sorry, I believe it's about 20. All the high schools in the city of Cleveland. And youth can choose to attend any, and we don't have a way to really link that student to their neighborhood to really pull it down to the geography. Another piece that kind of vexes us is understanding if it's the home environment or the school environment. And we've had this discussion even in a recent paper where we were looking at retailer density and the association with tobacco use in younger students. So this is also partly why we wanted to look at the race, ethnic, gender groups to see if we saw different patterns of use behavior over time. And so again, as I mentioned, we are encouraged by the consistent downward trajectory as well as the tightening of the span of tobacco product use from 2013 to 2019, but we want to continue to monitor that and ensure that those the prevalence continues to decline. I am just going to roll with the next question, Sarah, because I was able to bring it up, and it's about the same topic, why we think that signage compliance is such an issue in those areas. To be perfectly honest, I am not entirely sure. And what I will say, I was talking with a colleague about this data, and we thought, well, you know, what could be going on here? I don't want to assume that there's any ill will or bad actors in these retailers. But I want to remind everyone that at the point at which we came back, this was, excuse me, about a year after the policy had been implemented. And so it is entirely policy that those retailers had their signs up in April of 2016 when the policy was implemented, when they received those. And that just over the course of time, that piece of paper or laminated sign just was damaged. Now, one would say, well, why would it be more likely to be damaged on the east side versus the west side? But this is something that needs some attention and needs a little bit of understanding. And that's why I think if we integrate this into something like the inspections that are happening at every store on a regular basis, and this is something that can be supported by perhaps providing a new sign every year or a sign if the sign has been removed, we can continue to maintain that with hopefully a minimal investment of resources.
If there are any more questions, feel free to type them into the Q&A section or raise your hands. Another one, is there any data on menthol cigarette use in Cleveland?
This is not something that we have actively collected in our youth risk behavior survey. As I mentioned, within the city of Cleveland, among our high school youth, use of cigarettes is extremely low, around 2 to 3%. And we've not conducted a survey with adults within the city of Cleveland specifically since 2015. There is substantial interest in this because of the discussion of including menthol in any future flavor bans. What we know is that there's overwhelming literature that shows that menthol has been disproportionately marketed to Black and African American communities. And so we continue to have our eye on flavor and continue to think about how, if menthol is not included in future flavor policies, do we see youth shifting to this product? But we don't currently have this data for the city of Cleveland.
We have a comment. Great job, Erika.
Thank you.
Are there any other comments or questions? Please feel free to raise your hand or to type in the Q&A.
Well, I'll just take this opportunity to thank everyone for attending today. It's been very exciting to pull this data together over the past couple of months and look at this a little bit more closely. And I've appreciated all of your questions today. And thanks again for the opportunity.
If there's no more questions or any comments anyone would like to share, thank you all for joining us today. Please join us. We'll be having another seminar next month on the second Wednesday of the month, and that'll be our regular schedule for going forward. You can see our schedule and register at our website. So please join us for our next seminar. Thank you.